What people forget is our skin, largest organ in the body, is designed to keep things out. That's the
Yeah.
whole purpose of our skin, is to let good things in, keep bad things out.
This is MedSpa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate Dee. Together, we explore the wild west of medicine that is the aesthetics industry. Hi, this is Dr. Kate Dee, and I am speaking today with Dr. Jennifer Linder. She is the founder of Linder Health. She's a board-certified dermatologist and fellowship-trained skin cancer surgeon. She originally went to college at the University of Illinois, Champaign-Urbana, and I believe is an engineer. And then went to Washington University in St. Louis for medical school. She did a surgical internship at the University of Pennsylvania, followed by dermatology residency at Thomas Jefferson, also in Philadelphia. And she formerly had a clinical faculty position in dermatology at UCSF, which is where I did my fellowship. So somehow we miss each other and all of that. But anyway, Jennifer, thank you so much for being on the podcast today. I'm super excited to talk with you about skincare and peels and all of our favorite passions around keeping skin healthy.
Keeping it healthy, and that's what makes it fun, right? It's like we can do something that has such positive outcomes, and I'm really happy to be here and chatting with you and your listeners today.
Yeah, so thank you so much. So for more information for our listeners, so you are actually the founder of PCA Skin, which a lot of people will probably be familiar with, our audience. So both on the consumer side and on the provider side, a lot of people know about PCA Skin. That was a huge company. Can you tell our listeners just a little bit about how you got into to become an expert in skincare and how you ended up founding that company?
Yeah. I was not one of these girlies who thought I was going to go into skincare from the time I was tiny. I was not the kid that was playing in the sink with creams and lotions and potions. I was, as you mentioned, more on the engineering side, playing with Legos. So what happened to me was I love surgery and decided I wanted to be a Mohs surgeon, which is a dermatologist who takes care of skin cancer. And I've always loved the procedural side of things, working with my hands. And I also am a painter for similar reasons. And during my fellowship, my mentor realized you have a knack for the visual side of things, artistic side of things. So I started doing that. But during my fellowship, which also was a laser fellowship, I had melasma. And I made it worse by lasering my melasma. So one takeaway, people remember anything, please do not laser melasma.
Yeah, and I so agree with you. I know we talked about this the other day, but I want to do a whole podcast about melasma because I also feel very passionate about laser being ridiculous for melasma, and so many people don't understand that. But anyway, totally different topic. But
Totally, like you and I could talk about that till 2 hours on the side. But
I think
just
so.
one takeaway, please don't laser melasma. I made mine worse. And then when I was my first year out of school, I was exposed to another skincare company actually recommended that I try the peels of this company called Physician's Choice of Arizona. It was this little company, and they made great, what were called blended Jesner's peels. And it was really kind of cutting edge. It had started by this esthetician. And I happened to be going on vacation to Scottsdale and went down there, met the owner, met their head of R&D, and the head of R&D and I just clicked. We were like, when you just nerd out on stuff. And I had this idea for a sunscreen I wanted to do. So I started kind of helping out on the R&D side. And then it was one of those things where the peels, I'd already tried the peels and realized that they actually are what finally solved my melasma.
Mhm.
And I ended up liking the company. I like to say the old Remington microscreen. If you're of a certain age, you remember that, like, I like the company so much I bought it. So I bought this tiny company called Physician's Choice of Arizona. And myself and my husband basically grew it and developed it to what became PCA Skin. So I like to say we took this little germ of a company and created something else out of it. And I had this team that I adored and loved. My head of education, my PhD in chemistry has been working with me since 2005. And then that company, we eventually merged with Elta Skincare, which is a sunscreen focused company. And then together we sold those two companies to Colgate Palmolive. So I have
Mm.
been a dermatologist, a skin cancer surgeon, and at the same time been doing this entrepreneurial path. But it means I really get into the nerdiness of product
Mm-hmm.
development and the chemistry of it. And that's what I really love to do and think about. And I really missed it once it wasn't everyday part of my life. I did get the chance to focus on, I ended up having 3 kids and got to really focus on them through COVID. But during COVID, while everybody else was basically doing making sourdough bread and everything myself and my chemist and my who would they because they stayed friends and my
Yeah, of
head of
course.
education who actually lived with me through COVID, we were playing with chemistry and peels and doing things for ourselves and had this idea behind still thinking about melasma because that's always like a running thing behind in the background with
Mm-hmm.
pigment. And they kind of worked so well. We're like, maybe we should do this again. And we still saw a hole in the education piece, like how much better we can really try to think and educate and think about where there was holes in science. But I'm getting a little bit ahead of myself, but simply to say, this is what I've been doing for 20 years. I'm about as nerdy as you get. I mean, so
Which is, of course, my favorite kind of person. So we can nerd
yeah,
up.
let's nerd. Yeah.
Let's nerd up. So I would really just love to talk about why skincare really matters and why it works. I think one of the things that I heard a lot 10 years ago when I started down this path in aesthetics is that, oh, isn't that just a gimmick? Aren't they just trying to sell you stuff? Does it really do anything? Is it people with such skepticism that anything was worth the money? So can you talk a little bit about why actual, and I call it medical grade, and I don't, that's not a real term, but in my terminology, medical grade means that there's ingredients that actually have laboratory tested outcomes and that the thing that's medical grade actually, if it has a percentage whatever ingredient, it actually has that in it and it's been tested and the results have actually been tested in clinical laboratory studies. So that's my definition. I don't think it really has an official. I think that you can slap the word medical grade on things and it doesn't necessarily have any meaning. But can you just talk a little bit about why a real great skincare regimen actually matters?
Yes, because it really does matter. You're on the money. So it's kind of like we think as physicians, we think about medications and prescriptions all the time, right? And we have reasons to believe, and it comes down to reasons to believe, right? As you said, ingredients that are proven to do something. And then the other piece is it needs to be delivered in a medium that works. So in
Right.
dermatology, when we learn about medication, we think about what we call the vehicle because it literally is delivering the ingredients to where they need to go, is as important as the ingredients themselves. And
Absolutely.
so I like to say when you're thinking about in product development, it's the whole thing that matters, not just the ingredients. We often talk about the ingredients because that's a starting place. Because if you don't have that, it doesn't matter. But you still need to get them where they're going, and the products that as a whole needs to work together. And then there's the element of it. You need to have compliance because if it doesn't feel nice, smell nice, all those kind of things, someone may use it for a short period of time, but they won't use it long term. So let's just start with the assumption that skincare works because you're choosing ones that work because there's lots that don't, right? And as you said,
Exactly.
there are people who put they topics hot, let's say niacinamide, but maybe they're fairy dusting it because you put a little bit in there and you can put it on the label, but it doesn't actually make a difference. The one type of ingredient where a tiny bit really does go a long way are all the different peptides. But in
Hmm.
general, you want the active ingredients to be higher up on the list, except for
Right.
that
High
one where
enough
there are.
content so that enough gets into your skin to make a difference, to actually do what it's supposed to do.
To do
And
what
I
it's supposed
think
to do.
just to clarify for what Dr. Linder said is the vehicle is the base, right? The other molecules that are in the cream that you're putting on or whatever form it is that you're putting on your skin. The vehicle is that thing that allows the important ingredient to get in there into your skin, because when you put something on your skin, it doesn't mean that it's going to get absorbed. Like, a lot of things aren't absorbed at all, right? So it has to be in a milieu that actually the molecule you really want to get inside your dermis actually gets in there. Am I explaining that well?
You are explaining it perfectly well, because what people forget is our skin, largest organ in the body, is designed to keep things out. That's the
Yeah.
whole purpose of our skin, is to let good things in, keep bad things out. So we need to understand actually the science of how the architecture of the skin and the chemistry of the skin to be able to get stuff in. And
Right.
there's one of the coolest things about the skin is that it's lipid bilayer, we like to say, right? So the skin is actually, when you have, one of the things we often do, and when thinking about product development, is have a combination of things that are both oil loving and water loving, sometime within the same molecule, because then it can sort of actually, it's almost like a little snake where it kind of can weave itself in based on what part of the molecule is connecting with what part of the skin, which is, that's the stuff that I love, is when you're thinking about functionality. So
Yeah, and for people who don't know, like, how that is that when we say a lipid bilayer, right? Like, lipids are fats, right? And water and fat don't mix, right? Which is why when you make a salad dressing, you've got your vinegar layer and your oil layer, and they don't mix. You can shake it up, and then they separate, right?
mhm,
And the same deal is with your skin. So if your skin is made up of a lipid layer, a fat layer, water things won't go through it.
it
So
just
you
won't.
need a fatty part that will escort a watery thing through your lipid layer, right? And so
Exactly.
that's why the chemistry makes such a huge difference. And as much as I admire a lot of people who very famously made skincare products in their kitchen, they were not medical, they were not scientists, they made skincare products in their kitchen, and they got wildly famous and wealthy and sold lots of things. They might have stumbled upon things that got the right thing across the lipid layer, but like that, really, if you want to design a really awesome molecule, you have to actually be a chemist and figure out how to design that molecule so that it will actually be absorbed. Because I think a
Right.
lot of things, like, yeah, anyway.
It's so true, though. I mean,
Yeah.
this is why this is a big thought process around dermatology. How do
Yeah.
we get things where we want it to go? The other thing that can happen is you can have receptors in the skin where the receptor is sitting there waiting for a molecule that it recognizes, and then it's, oh, hello, you're welcome to come on in. And
Yeah.
that often happens with something like the vitamin A molecules. So what you often hear about is retin A, which is also called tretinoin, and then the retinols, retinaldehydes, all these different ones, because there's a couple of receptors that actually go, oh, and you're welcome to come in. The same thing happens with vitamin C's, but with vitamin C, we hear about all these different skincare products where they make them, because vitamin C is not very stable, and so people will make these forms that are more stable, but they don't think about it's not in a form that the receptor can actually recognize. Makes me crazy. So look for, when you think about vitamin C, L-ascorbic acid is what the version you're looking for. But so back to what we were originally saying is, why does skincare work? And skincare works because of the fact that you can have active ingredients that do interact with the skin. You have a well-designed vehicle that can get it to where it's going, or you're doing something specifically that's going to go after a recognizer receptor. And then you're actually triggering a response. So that's what's happening in good skincare. The other thing is,
And what's that
people,
response that you're trying to trigger
so
for
often
our
that's when
audience?
I'm thinking about, I'm actually wanting like something with vitamin A or vitamin C. I'm actually wanting to turn on an antioxidant or limit free radicals, things that are actually causing damage from pollution. Or I'm triggering cell turnover, which is what retin A does. Or some of these things, actually, both those molecules actually work on melanocytes that are making pigment, and something
Right.
like melasma, like we were mentioning. But sometimes what we also want to do is we want to just keep the skin healthy, give it a situation so it can do its job the best way it already knows how, right? Our bodies are magnificent in how they function, but we do things all day long that are hindrances to the skin. So even traditionally, like a traditional face wash, not a face, but like a soap, when people are like, oh, I want my skin to be sticky clean, that means you've actually taken the lipids, the fats out of your skin. And that's the reason why it feels that tightness. That is not a good thing. If your skin feels tight after you wash your skin, that is not a good sign.
That
The
means you
other
need
thing,
a moisturizer big
it
time.
means you need, or you should probably just use a different cleanser. Let's start with
Right.
that.
Yes.
Or
Yes.
something. So, and
I
now we
mean,
think
unless you
about,
have oily skin, acne prone skin,
right.
where you want to actually do that to your skin.
Right. And but then you're wanting to use ingredients, something like salicylic acid or benzoyl
Hmm.
peroxide, which is actually
Yeah.
going to have a chain reaction. You're still, if one of the common things that happens is people with acne prone skin because their skin feels oily, they try to strip it off, and the
Hmm.
body's response then is to make more oil. So it's all about understanding what's happening within each disease process. So moisturizing the skin is one of the most important things people could do. Moisturizer, sunscreen. If nobody does anything else, do those two things, because having your skin well moisturized is actually one of the things you have to do to keep a healthy microbiome of the skin is moisturization followed by regular acidification. It's the reason why I like chemical peels, and then actually controlling inflammation. So that's why skincare works. Like it's kind of like, how do we know medicine works? Well, it's a complex thing, but it really does work if you choose the right things.
And so when you talk about the microbiome of the skin, I'm assuming you mean all the little, I hate to say, creatures that are living on our skin.
True though, yeah.
Yeah. So there's a healthy microbiome and then an unhealthy microbiome. Can you talk a little bit about that?
Yeah. So a healthy microbiome is all the good bacteria in the right percentages. It's sort of, I spend a third of my time near Yellowstone. And in Yellowstone, if you have too many wolves, they're going to eat all the deer and then the system doesn't fall apart. But
Right.
when we didn't have wolves, we didn't have enough, like there was too many deer. Actually, the land was stripped. And so you
Hmm.
would need to have the right amount of things. So we want to have staph and strep. We actually need to have some little viruses and some all sorts of different little things going on. That's a healthy microbiome. But things can get out of proportion, which is often what happens with acne is the microbiome is actually out of balance because the hormones of especially puberty trigger like too much oil production and things get sort of out of whack. And so a healthy microbiome is important for overall healthy skin and to make that organ system work well.
Yeah. So what would you describe as an ideal skincare regimen each day? It's going to be different for different skin types and everything, but what would you describe are the basic components of a good skincare regimen?
Great question. So number one would be choosing a face wash. I like to say at a minimum, I like wash your face at night, get all the pollutants and everything off your face because your skin actually rejuvenates at night. So having a clean palate is a wonderful way
Hmm.
to start. And it should be pH balanced, which means you don't need a toner because
Right.
toners were actually to acidify the skin after you used a too basic cleanser. So just a cleanser. Then we just mentioned sunscreen. You have to wear sunscreen. Even if you have ebony, dark, melanated skin, I think you should still wear a sunscreen.
Hmm.
Your sunscreen can have enough moisturizer in it that can be your moisturizer for the day. Often people, especially as we get more mature, might need additional moisturization at bedtime. So that's sort of like plus minus whether you need that or not. And so to me, that is like the simplest routine is cleanser, moisturizing sunscreen. Then you can start adding things in if you need them. So then my number one choice would be a great moisturization thing. I really love the hyaluronic acids that do additional things. So that's one of my favorite ingredients. Then I like to start thinking about antioxidants and correctives. And so then vitamin C based things are I love to do in the morning, and you can do that along with your sunscreen and actually it sort of boosts your sunscreen. And then if somebody is wanting to think more corrective, they're trying to reverse pigment, they're trying to be protective of, they've developed fine lines and wrinkles, they want to trigger more cell turnover. Then I might add something like a vitamin A in the evening.
Hmm.
So and then the one ingredient that we find does wonderful things across the board is niacinamide. And that's a vitamin B. So the easiest way to remember this is ABC. So A, vitamin A,
Hmm.
B, niacinamide, and C, vitamin C. And if you do those things along with moisturization, you're probably in a great place.
Those are great recommendations. I would
Yeah.
love, you know what, I just thought of another podcast we could do is about all the anti-aging ingredients, which I don't think we have time for, but I think that'd be really, really fun because I want to hear your opinion about all these
Of
different molecules
course.
that we've experimented with. But anyway, okay. So we have the basics of, do you have people wash their face every day, twice a day? Because if they're willing, I usually have people wash their face in the morning because they're going to do one application of their antioxidants and their anti-aging stuff and moisturizer and sunblock. And then in the evening, same deal, but obviously they don't need their sunblock at night. And then that's when we add the retinol for most people, or the retin A. So I know that occasionally I'll have somebody who like, oh, you're not going to make me wash my face even once a day, are you? Like,
So,
recommend.
I mean, I obviously, if somebody will wash their face twice a day, that is my preference. At a
Yeah.
minimum, I'm trying to get somebody to wash their face once a day, and then my choice is to do it at bedtime to really
Hmm.
cleanse the whole palate. Essentially, if someone, as we mentioned, is their your acne and those kind of things, you really need to be cleansing your face twice a day. But
Yeah.
I also, for some people who are really like resistant, I'll have them put your cleanser in your shower, wash your face while you're in your shower. At
Hmm.
least do that. Let's not use our shampoo as our facial cleanser, and at least get them
Or
to
your
do
bar
that, right?
soap.
Oh, your
Don't
bar
use your
soap.
bar
Yeah.
soap.
Yeah.
Yeah.
Please, no more, whatever, Irish Spring and all those things. So, as I mentioned, no squeaky clean skin. And so that's what we really try to encourage people to do. And I like to say, in terms of skincare in general, it's like your teeth. If you just went to the dentist twice a year, your teeth are, even if you're getting them cleaned twice a year at the dentist, your teeth are not going to be in great shape. You got to do something on a daily basis to take care of
Right.
your teeth if you want them to be healthy and last your lifetime. And in the same way, you should go see a skincare professional at least a couple times a year. They can help you make great choices. I personally love getting peels and facials and adding peels onto those things and doing medical treatments because it sort of does help keep everything in a healthier place.
I often will say to patients, like, because people are coming in to see me to do, anti-aging procedures and maybe Botox or something like that. And I really cannot let them go out my door without talking about skincare because it's like, hey, you're coming in here for these big procedures. It's so important to take basic care of your skin. It's like going to see a personal trainer to get like buff and fit and healthy, but then eating at McDonald's is like putting your skin on a really good diet. And I
You,
just think it's so important. It also will maximize your results from any procedure that you're going to do. And there, we didn't really talk about ingredients that boost collagen or that stimulate collagen. But if you've done a procedure to stimulate collagen inside your dermis, there are a number of ingredients that will help boost the yield on that, right? And so all these things are really, really important and they work together. So it is sometimes hard. I mean, maybe our listeners probably are into it, but I can tell you a lot of people are like, oh, I'm so busy with my kids and I'm running around and I'm working all day and then making dinner and getting my kids to bed. And I just don't even have time to wash my face. I'm like, well, my whole skincare routine takes 2 minutes. You can do this. If you can't take 2 minutes for yourself as like a busy parent, like you got to start somewhere, right?
yeah, and I mean, you wouldn't skip brushing your teeth, right? It's sort of like the
Well, some
same
people
kind of
do
thing.
it. Not a good
Yeah,
idea.
not a good idea in general. I highly recommend doing it just for the pleasantness of the
Yeah.
people around you as well. But it
Yeah.
is like that little moment, and when people can actually take a moment, I recommend that the cleanser that I last formulated actually has a scent in it that's really fresh and refreshing, and I actually recommend people take a moment, take a moment, and then think about in the morning what you're grateful for. Or I mean, at
Hmm.
bedtime, what you're grateful for. In the morning, think about what your intentions of the day are. And even just taking that moment for yourself will just shift things. And it's that whole part of when we think about holistic health, the mental side of it as well is really important.
Oh, I think that is so huge. I do, for me, like washing my face in the morning and the evening is definitely part of my kind of mindfulness routine. I think that's a great way to incorporate that, both of those things. So many people, a lot of things go by the wayside because we're so busy these days. So I was really hoping to talk a little bit about your new company and the peels that you're creating because they're really unique. And so can you talk about Linder Health and what is it you're doing that's new and different with peels and what we're accomplishing with that?
Yeah, so peel's been around for millennia.
Hmm.
Cleopatra had a herd of donkeys she kept to have sour milk to actually bathe in every day. And then peels sort of really came about in the first in the 30s and the 50s and then 90s is when glycolic acid peels became sort of the biggest thing. And but the science behind them really had not been updated that much. So some studies came out around how chemical peels in the right percentages at the right pH, I like to call it the sweet spot, actually can be supportive of mitochondrial health and can be actually senolytic, which means they are killing senescent cells or the zombie cells that are partially responsible for aging if you go after the sweet spot of a pH between 3 and 4. And we also know that, as I mentioned, by regular acidifying the skin, it does keep the microbiome in a healthy place. So during COVID, as we're all geeking out, and I like to read PubMed, as I'm sure you do, like looking for new interesting things when we're in our space, realized that there was really room for improvement. And thinking about the other big thing was inflammation. We know you hear about aging across the board in any organ system we're talking about. We're trying to control inflammation. And peels we traditionally were using, especially those with phenol or TCA or resorcinol, actually have a strong inflammatory component. You're kind of harnessing wound healing. But it's
Mm.
possible to get the responses, positive responses, and positive wound healing without being as inflammatory. And so that was really the goal: was how do we create peels that aren't inflammatory? And that's what myself and my chemist worked on during COVID. And it worked. And we were sort of shocked at what wonderful results we could get after just one treatment. And then I usually like to do things in series because you get even better responses. But
Yeah.
just after one treatment kind of surprised me for superficial chemical peel. And that's when we're like, oh my gosh, I think we need to do this again. And plus, I mean, this is what I love to do, is thinking about things in a really problem solving way. Okay, for a clinician, what are the difficult moments? And then how do we solve those? And how do we do it with the utmost sense of integrity and ethics and do things in what I believe is the right way? Because I think when you do that, everybody, all boats rise. And so that's what was sort of like the nugget of what became what is now Linder Health or and the LH Labs peels. And it's all about really controlling inflammation, which means that you can do the peel in concert with other treatments. So you could do it along with many different things like microneedling and non-ablative lasers and IPL. You can do it with enzymes or facials. And the nice thing for the patient is the same day you do the consultation, you can do a treatment. You're not having to take time off from your skincare routine you're already doing. And you can continue to have your normal life and go out and take your kid to the baseball game, as long as you're wearing sunscreen, of course. There's not the limitations we traditionally had to do with peels because of the fact
So
that we're controlling inflammation.
so let's just drill down on
Yeah.
what that means. So traditionally with those harsher peels, they caused a lot of inflammation, and so there was redness and your and well, obviously a lot of them cause your skin to actually peel off, right?
Mhm.
And so what you're saying is the peels you're designing don't cause that kind of reaction?
They don't cause that inflammatory reaction to the same
Yeah.
degree. So
Yeah.
instead, you're still going to get
And
the
are they
same
still
amount of,
peel?
they're still peeling. You still get the exact same
Mhm.
amount of peeling, but because of
Okay.
chemistry and relying on things like mandelic acid, salicylic acid, combined with things that allow them to penetrate deeper, relying on, as we've talked
Mhm.
about, how lipophilic and actually how we're getting it
Yeah.
in, it comes off in tiny little bits. So it comes off more like dandruff. So you might see it if you're wearing dark clothes rather than
Then
sheets
in
of skin like
sheets?
a snake. Yeah.
Uh-huh. For someone who has had a big peel before, where their
Mhm.
skin kind of came off in sheets, which I actually we use a peel that I've really loved. It works really well. That causes that in my
Mhm.
clinic. So it's coming off in little tiny bits.
Yeah, you might still,
It
where the skin's a little bit thicker, like right around the nasolabial fold in
uh-huh.
here, especially someone that hasn't been treating their skin quite as much, you might still get a little
Uh-huh.
bit more there, but it's more like for a day or two, not for a week. So it's a
So
little, yeah.
so peeling for less amount of time,
Mhm.
and I guess what, less obvious, so
And
less
less obvious. I like to
visible.
say limited social downtime because as your
Well,
people are
important
so
because
busy, right? Yeah.
yeah, yeah. So you can go out and do your normal things more quickly because it's not coming off it. Because it's not that you can't with a traditional peel that causes this sheet sloughing. you can go out. You just look kind of funny. It's very
You
noticeable,
you
right?
get the
So
little, like, the 2-year-old at
like,
the
oh,
grocery
what'd you
store.
do?
Yeah.
What's wrong with your face, ma'am?
Yeah.
Okay. So there's less downtime. Can you just put a moisturizer on and go
Oh,
out of your
you
normal
can
business?
that's the whole idea.
Okay.
Exactly. So put a moisturizer on and continue with your day, of course, for sunscreen.
It's
But
just
that's
as effective as those other big peels, but
yeah.
it's not as noticeable. Okay, so that's kind of awesome.
And
Does it?
and in many ways even more effective because you're not going backwards to go forwards.
So do you have different peels designed to do different things?
So the primary peel is one called the Linder Health Hero Peel. And because it was developed
Hero
during
peel.
COVID, it's
Okay,
like hero. It's like really is your hero. And then
full name.
another one is called Spotless. It's really for that truly acneic patient. That one has a little bit more glycolic. It actually has a little bit of glycolic acid in it because with oily patients, you do want to rely on glycolic, which could be more dehydrating to the skin. And then my favorite one is something called the Polite Peel. And this one you can
Polite.
do polite because it's
Oh,
kind to you.
polite.
And that
I
one
like
is
that.
it's a great peel that you could do the day of an event. You just want to look fantastic. I have several patients that fly internationally a bunch and they do it the morning of, and then when they land, their skin's looking glowy and great. We
So
can
you
even
could
do it on
same day.
same day. And you can
Wow.
do it on
Okay.
eczema, psoriasis, all that and kind of inflamed skin. It actually helps to calm down skin. Wonderful, especially on inflamed rosacea. I've even done it on patients with sunburns because it really is
Wow.
because it has a high glycerin content as well as the traditional peeling ingredients.
So
So
whoever, I mean, that's kind of amazing. For if you don't know people in our audience, like being able to on any of those things is pretty unusual. So it's
it's I
more
don't
than
even
just a
know if
peel.
there's another one that you can do that with.
Yeah.
Yeah.
Okay.
Yeah.
I haven't heard of one. So you can actually, it's almost just like a topical treatment that helps heal those disorders rather than a traditional peel in any
Right.
way.
And it actually hydrates the skin. So you're triggering cell turnover at the same time as hydrating the skin, helping it heal. There's also tranexamic acid in it, which is
Oh,
really
wow.
great for
Yeah.
pigment, anti-redness, and anti-inflammatory.
Do you use any of these peels for melasma then?
Oh yeah.
Which
So
one?
my favorite one is actually the Hero Peel because it has the highest percentage of tranexamic acid in it, as well as mandelic lactic, and it really triggers cell turnover. And so I can even the way because these are anti-inflammatory, you can do these peels as often as every 2 weeks. And
Amazing.
and this melasma patients want it under control as quickly as
Oh, yeah.
possible. And so
I
that
mean,
makes a big difference.
for sure. Yeah. I mean, again, we're going to save that whole conversation for
Yeah.
our next podcast. But yeah, melasma. I mean, that's really awesome. Do you use the Hero Peel just for anti-aging as well?
Oh my gosh, yes.
Yeah.
That's kind of the mainstay. I like to say that probably 75-80% of patients, that's the perfect peel for them,
Hmm.
is usually the one that's used the most commonly.
I love the idea that you can do this with minimal downtime. When you combine it with things like microneedling or a non-ablative laser, that's going to increase the absorption of these peels in a huge
Yes,
way.
absolutely.
Is that ever dangerous? Can you do it in a way that, okay, there's too much absorption and now you're getting too much, or is that totally safe?
So because these peels are designed, you put a layer on and you leave it on, and then you put another layer on and leave it on. The number of peels you put on determines how much absorption you're getting. So when you're doing something like microneedling or a non-ablative laser, you're going to do less number of layers. And that helps you sort of determine it. Also, how much kind of sensitivity the patient has is also a
Uh-huh.
determining factor. So we have, when we teach people how to use them, we use those as tools because you're using the patient's own skin to tell you how much to put on.
So is that a judgment call that the person doing it, presumably an esthetician? Do you have estheticians doing
Yes,
these?
yes, I
But it's
do.
they are having to look at the response of the skin to make sure that it's
It's
not too
actually
much, or
your own. So I like to say, I like to use a pain scale, like the traditional 0 to 10 pain scale. And as long as somebody is basically a 5 or lower, I'm comfortable with doing another layer. If
hmm.
somebody is doing a non-ablative or a microneedling, I like to max out on 3 layers versus if they're doing a peel on their own or with an enzyme or something like that, I'm comfortable going up to 6. And then often I
Okay.
say the first time you're doing it, do one. That way it's, as we say, first do no harm. And you're always better seeing how somebody responds. And then the next time they do it, you can always do more.
Hmm.
But it's very, the whole idea is education at the forefront to really teach people to be comfortable, and then using science to make it safe. Because it is about that's that's what I loved about this was the opportunity to make things safer, more effective, easier for the clinician who's running a clinic to feel comfortable with their staff doing it. The actual person who's doing it can feel comfortable treating the patient, and for the patient to feel safe and comfortable. That's number
Yeah.
one across the board for everybody.
And then, so the what we've been talking about are kind of clinical peels. Do you have at home peels as well?
We don't have at-home peels at this time. Not saying that I
Mm-hmm.
won't do that in the future. We do have at-home skincare that's designed to be really fun to use, really high science. I like
Mm-hmm.
to say, oh, as a company, we're very complex, but we're not complicated. So easy to use, but all the complexity is sitting in the science of it. We have one product coming out in the near future that's called a 5-in-1. And I like to say that it's the perfect thing for somebody who is doing neurotoxins or they're doing fillers because it helps to plump the skin. You're actually a small enough hyaluronic acid that you're triggering the body to make its own hyaluronic acid, as well
Mm-hmm.
as 4 other types of HAs that actually are traditional occlusives and moisturizers. And then it has neurotoxins and has arginine in it for all those people out there who love peptides. It's that one that works on the same receptor as Botox, but it's a reversible binder, not an irreversible binder, which means you have to use it every day, but it actually
Right.
can slow down muscle movement, which, I mean, how cool is that we understand how to do those things?
That is just amazing. I think all this, I need to get these in my clinic because I just think that these would be a really great addition to what we already do. It would like totally fit in with so many of our protocols that we already have.
Well, and I think because I've been a clinician first, is realizing that one of the things that makes me crazy is for clinicians out there when you want to work with a company, they're like, oh, you have to buy thousands of dollars worth of stuff to bring us into your practice. And so for us, it's no, you have to buy one thing basically. It's like you get to
Yeah.
choose what you know fits into your practice well, and we work so nicely with other skincare lines, with other modalities, with other laser companies, because I think when you do things well, you're comfortable working with lots of other people because it's designed to have
Yeah.
that versatility.
Well, I think that one thing that I've learned over the years is that different skincare lines don't necessarily play nice with others. And so some just don't layer well, they pill or even Dr. Leslie Bauman taught me this in a lecture one time. There are certain ingredients that if you combine them or if you layer them together, they actually can form carcinogens. So it's, oh my God, how do you know you're not doing that? And that, because you could be unwittingly layering two ingredients that now are like super bad for your skin. So I think that playing well with others is really, really important, right? And it's really hard to know as a layperson or even as a doctor. I mean, I don't know. It's really hard for me to read the giant list of ingredients on a skincare product and the giant list of the next skincare products ingredients and make sure those are going to go well together. That's hard to do. There are very few
It's hard.
people, I think, in the world who can do that.
Well, and as we were talking about, even just that simple thing of like water, and when you talk about water and oil, don't mix well together. So, like, how do you
Yeah.
know how these other things sort of play nicely together? And that's where a well designed product is thoughtfully designed to absorb in such a way that it
Hmm.
can work nicely with makeup or
Yeah.
whatever else that people want to put on. And I mean, that's really my obsession around sunscreen is sunscreen needs to be absorbed. It needs to not pill on the skin. I find
Hmm.
with men, if you give them a sunscreen that is going to stick to their beard, they are not going to use it.
Yeah.
And
No
so,
way.
yeah. And then also, like, to think about all skin types. Dark melanin skin needs to be as thoughtfully considered when we do product development as pale skin.
Mm.
So, as a result, when we did our first sunscreen, it was designed for the darkest melanated skin for men with a little bit of moisturizer in it so that it actually goes in nicely, because it's, I like to say, sunscreen you should need to think about like you do with clothing. You're not going to wear the same thing in the beach that you wear to the office every day and what you work out in. So you have to have different
Right.
things that have different qualities for that same reason.
Yeah. And I always think that like people just need to find a sunblock that they love the feel of on their face so they'll wear it every day.
And then put
And
it next to
actually,
their toothpaste. So they actually
Yeah,
put it
and
on.
you just have to want to wear it. Like I didn't tell you this before, but I mean, I use Elta MD sunblock every day. Like I love it. And the thing I love about the Elta products is that there's a different feel and finish to all of them. So you can find one that you love the feel of. And there's of course tinted ones and not tinted ones. So we don't have a lot of testers in my place, but the one thing we do is all the sunblock so people can like feel it and go, oh, that feels so good. I would wear that. And like for me, the one I use, I like so much that even at night, if I'm going out, if I'm washing my face and going out, I put my sunblock on because I just love the way it feels. And
That's
and I
so great.
which is kind of goofy, but whatever. I like it. It's a
No,
little tinted and I don't wear makeup at all, so it's the only thing that has any kind of tint or anything that I wear. So
it works
but
for you.
yeah, it does.
And
It's
as I
fantastic.
mentioned, my chemist who's been with me since 2006, she was running R&D for them, and then followed me to my new company. So to give you an idea, like that finish, that putting everything together is important across. I think any
Yeah.
well-designed medical skincare company plays with that. I'm going to have you try our new sunscreen because I think you'll love the
We'll
sunscreen so
try
much
that. Okay.
because it
I'll
has
try
a really
anything.
beautiful feel and finish to it.
We're always kind of demoing new products in my office and we look at all the research and then everybody uses it and we kind of decide if we have a role for that. And I try not to have every SKU on the planet because it's too much.
It's too much.
But we're always investigating new products. So that's always welcome. And honestly, with sunblock, you have to have a variety of things because everybody likes something different. Some
Huh?
people like a dewy look. Some people like a matte look. In between, it's tinted, untinted. It's all very much what you like the feel of.
Well,
And
I
if you
think you're
want to
really
get
doing
people to wear it every day, you absolutely have to find one that they love, right?
completely. Well, I love the fact that you and your team test everything that you bring into the practice
Oh yeah,
because trust is everything. I think that's the number one thing that our patients rely on is the trust factor. And if you lose the trust piece, then you've lost everything. I mean, that's the basis of medicine, right? So
yeah.
I like to think about it that way is basically it's like trust in a bottle essentially.
Oh, exactly. And I also like to think about skincare as just you can really make your skin look its best so you feel confident in your skin the way you feel confident in your clothes. And I like to tell people like if we do our jobs right, like we can help you love your skin the way it looks so you won't need makeup. You won't feel like you need to cover it all up. And
Uh-huh.
I know that's my bias because I don't wear makeup and I know I never really have, but I think it's really great to be able to just walk out your door and feel great in your skin. I think it's possible for most people. I really think it's possible.
As do
So
I. There's definitely ways to get healthy so it does look its natural best. And then if somebody wants to wear a little bit of lip and a little bit of eyeshadow or mascara, it sure makes your morning a lot easier than if you feel like you have to really do it
cover
whole.
everything.
Cover
Yeah,
everything
for
up.
sure. So Jennifer, so first of all, I hope you'll take me up on my invitation for another
I would love to do
recording, at
that.
least one, because we have so much to talk about. But before we wrap up, can you tell our audience how to reach you and all your various venues?
So the easiest way to get a hold of me is on my socials. I'm at Jennifer Linder. That's Linder MD, like medical doctor. Or you can also just reach out at Linder Health, and we respond to everybody. I love nerdy questions that people pose, and I like to do a lot of lives where we're asking, answering questions, and doing those kind of things as well. And I would so love to come back and have another conversation with you. I think you and I are so like-minded. It makes it really fun.
Yeah, that would be fantastic. If ever you want to bring some of those really interesting questions, we could answer them on the podcast too. That would be really
Yeah,
fun.
that would be
So we'll
fun.
have all those links in the show notes, and then we will come back another time and we'll talk about melasma and skincare questions. So Jennifer, thank you so much for speaking with me today.
It's been an absolute pleasure. Thank you for inviting me.
If you've learned something and like what we're doing, please tell your friends and give us a 5-star rating in your podcast app. If you have a question or a crazy story of your own you'd like to share, please send an email or voice recording to info@drkatedee.com. That's DRKATEDEE.com. Or reach us through the website medspamayhem.com. And read the book. MedSpa Mayhem is available everywhere books are sold. Thanks for listening. This has been MedSpa Mayhem with Dr. Kate Dee. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to hit subscribe on your podcast app and leave us a 5-star review. And read the book. MedSpa Mayhem is available everywhere books are sold. Links and more can be found in the show notes and on medSpamayhem.com.